This is one I've been talking to a bunch of people about. How good or bad are public health data systems at the state level? The Ohio Department of Health, this is from the article, the Ohio Department of Health's COVID-19 data has been skewed by technical issues related to lab reporting, although Ohio Governor Mike DeWine noted the virus is still spreading quickly across the state, according to local ABC affiliate News 5. Cleveland, the state reported COVID-19 cases were artificially inflated, so forth and so on. You get the picture. These state systems, I talked to a bunch of CIOs just last week on a panel, and we were talking about this. The states are not getting high grades for their ability to receive the data. They're asking for the data. The data is required by the CDC. It's required by, well, at one point it was required by HHS and CDC, but it's required by the CDC. It's required by the state. They're saying, we need this data. And then they send it, and they really don't have great mechanisms for collecting that data and collating that data. And that's pushing the burden down to health systems, which is pretty interesting. One of the things I talk about a lot, people say, why don't we have interoperability in healthcare? And one of the things is, I go back to a story when I was the CIO for a health system, and I sat in a meeting, and I think it ended up going about 3 hours. It was ridiculously long, where we were trying to define something that I thought was like a pretty simple definition. It was something like discharge or something like something. So it was a simple definition. I really wish I could remember which one it was. But anyway, the process went on for 3 hours, and we ended up with 6 definitions. Now, the problem with that is, with 6 definitions and the information showing up on the better part of 100 to 1,000 reports within our health system, we have to be real clear what the definition of that data is on each report. Because if it can be 6 different things, it will be 6 different things, and it will be based on whoever's seeing it and whatever the lens is. That's a problem for another day, and a discussion for another day in terms of governance and the hard work that we have to do around governance. But with regard to saying, hey, the federal government should define these things more clearly, or the state should define these things more clearly, when I hear that argument, I sort of laugh, because we can't do it within our own health system to define the data. And now essentially what we're saying is, hey, let's pass the buck. Let's get the federal government to say, hey, the definition of this, or the definition of things that we can't even define within our health system without nuance and other things, the federal government's going to define for us. I don't think we really want that to happen. We do want a standard way of reporting, a standard set of definitions for certain reports. And for that, I hope that the state and the federal government can come together. A question that often comes up is, do we federalize this, right? Do we allow the states to continue to do the collection, which is, I think, as it should be, but we provide them a lot more guidance, not only around the data and the terminology, the ontology, but also the technology.